Hello and welcome to this session on a brief history of medicine. I welcome you all to this session. This is basically a recording of the session of a brief history of health and medicine. I'll give you a bit of overview of the session and then I will take you through the learning outcomes. I'm myself Dr. Anita Koso. You can access these recordings whenever you have free time. I know you all are busy, so we make it convenient for you by recording it, and then you can have access to the recordings on your Moodle website. These will be posted there shortly. So I prefer an interactive session. However, with the recordings, it's hard to have an interaction. You can have a look at the recordings, and if you have any questions, I will let you know my email address as well. So yeah, so a bit about myself. So I'm Dr. Anita Koso, and I work for the University of Greater Manchester. That's in Bolton, and I'm a full-time lecturer there for medicine. So I'll just share what this unit is about. So this unit is basically it's a brief overview or a brief history of health and medicine. I'll take you through the contents that you will be expecting to cover in the two learning outcomes. So there are two learning outcomes basically, and then there's a discussion on the assignment. Okay, so most of our units, they have assessments at the end. So just a minute. So I'm sharing my screen with you. I hope you can see my screen. So this is basically a unit covering two learning outcomes. So the first learning outcome is to understand the concept of healthcare in the 18th and the 19th century. So this has certain other components that you will be covering as well. So the first is to summarize the patient knows best approach. What is this approach? We'll be talking about it, to medical treatment in the 18th and the 19th century. And then we go on to explain in detail how dissection led to the practices now used in modern medicine. Then to evaluate the importance of RISE in laboratory medicine in hospitals, to clarify what is meant by germ theory. So these are the 4 learning outcomes that are associated with this major learning outcome, number 1. The second is to understand the changes in medicine that brought about today's concept of doctors know best. So initially it was patients know best. Now it is doctors know best approach. So here we go on to summarize the way in which the key individuals contributed to modern medicine, and then to explain in detail how the invention of key medical implements and machines advanced the field of medicine. And then the third is to analyze how the advances discussed in criteria number 1.2 through 2.2 moved medicine from the domain of the patient to the domain, to the domain of the doctor. Okay, so initially it was the patient knows best, and later on it became the doctor's knows best. So that was a bit about this, and I'll go on to share with you the first learning outcome. Any questions that you have, I'll again share with you my email address. So I hope you can see my screen again. This is so this is a brief history. I'll be talking about what it entails and what how do we understand the concept of healthcare in the 18th and the 19th century. So a bit about the indicative content. So the following grade descriptors will be applied to the assessment of this unit. So we'll understand the subject, application of knowledge, use of information, communication, presentation, and quality. Okay. So a bit about what is medicine. So medicine is the science and practice of caring for a patient or a service user, managing the diagnosis, prevention, prognosis, treatment, palliation, or reduction of the injury or disease, and promoting their health. And from there, we go on to describe what is health. So, according to the World Health Organization, it is a state of complete physical, mental, and social well being. And it's not merely the absence of disease and infirmity. This is according to the World Health Organization 1948 definition. And it is also a resource for everyday life, not the objective of living. So, health is a positive concept emphasizing social and personal resources as well as physical capacities. You can have a look at this presentation. However, this YouTube video, it shows you a brief history of medicine. So it tells you about what is medicine. So a bit about what this video entails. I'm unable to show you the video at the moment, but I can talk about it. That it talks about medicine being the science and practice for caring for a patient or a service user, managing the diagnosis, the prognosis, prevention, treatment, and palliation of their injury or disease, and to promote the best of their health. Now, a bit about the summary of the patient knows best approach. So there were two approaches, as I mentioned earlier. The one is the patient knows best approach to medical treatment, which was there in the 18th and the 19th century. What is this? So the patient knows best it's an innovative solution to put the people in control of their medical and care information, creating the basis for truly personalized care. So whatever you do it according to the patient's knowledge, according to their understanding, etc. So there's a review article on Moodle that states patient knows best. You can have a look at it. It's the patient-centered approach, so everything surrounds the patients themselves. This entails empathy, empowerment, holistic approach. So whatever is happening, it's under the influence of the patient themselves. It's a collaborative technique. It's independence given to the patient, its culture and background of the individual and decision making. Now coming towards the patient knows best, that came as things shifted. So the patient knows best, this phrase often refers to, so we're still talking about patient knows best. The next phase was the doctors knows best. So for this phase, it often refers to the concept of patient-centeredness or patient-centered care in the healthcare sector. So patient-centered care, it's a theoretical framework, and this emphasizes involving patients in their healthcare decisions and considering their preferences and values. Patient-centered care, where the patient knows best, aligns with the principles of the patient-centered care. And their healthcare professionals prioritize the patient's preferences, values, and needs in medical decisions. This approach has its emphasis on shared decision making. So the patients and the healthcare providers, they give a lot of weightage to the patient decision and to their comfort, and it aims to improve patient satisfaction and outcomes. Patient knows best platforms, these are also, there is also a platform called Patient Knows Best, and this provides patients with access to their personal health information online, allowing them to store and manage their health records securely. This platform aligns with the concept of patient empowerment by giving individuals control over their health data. So there's an article where you can have a look at human cadaver dissection. It talks about a historical account from the ancient Greece or Greek era to the modern era, and just how it is now. Please have a look at it. So then there is the evaluation of the importance of the laboratory or laboratory medicine in hospitals. Please have a look at this. And there's laboratory medicine, which is faced with um, the evolution of medical practice. The 10 advances in laboratory medicine, all articles are there present on Moodle. The germ theory, a bit about the germ theory. Just a minute. Okay. So yeah. So a bit about the germ theory again. So this germ theory, it's described in greater detail below. So it's one of the several scientific theories that you will read about in the subject of human biology. A scientific theory is a broad explanation of events, and scientific theories are widely accepted by the scientific community. To become a theory, an explanation must be very strongly supported by a great deal of evidence. People they commonly use the word theory to describe a guess or a hunch about how or why something happens. For instance, you might say, I think a woodchuck dug this hole in the ground, but it's just a theory. So when you use the word theory in this way, it is different from the way it is used in science. When you use it in a scientific way, a theory is not just a guess or a hunch that may be true or not. It's an explanation actually that has a high likelihood of being correct because it is also well supported by evidence. Have a look at this video. It's about the germ theory, and it talks about the link between germs and diseases. So microorganisms were discovered very early in the 17th century. Many didn't make the connection between the germ and the disease. Scientists believe that these microbes were created by, some people said there's air. So malaria got its name by for instance. The word malaria comes out from uh, mal and then area. So mal was bad, like malpractice is bad practice. So mal is bad and area is air. So these are different ways in which diseases were connected to different things. Um, in a way, malaria is associated with bad air or a bad environment, but it is the mosquito that was not in that theory earlier, and later on it got discovered. This was through the theory of spontaneous generation, where you could spontaneously generate the germs and then to produce um, disease. So the germ theory of disease states that when they're contagious diseases, they're caused by germs or microorganisms, which are organisms that are very small because they're micro, they're very small. They cannot be seen without proper magnification through proper um, microscope. And microorganisms that cause disease are called pathogens. So patho is disease and gens is the organism. So pathogens are those organisms that cause the disease. So let's say a rat is not a pathogen, it's a vector that carries the plague virus. Okay, so it's and the rat acts as a as a reservoir and it carries that pathogen, that virus within itself, and then it causes disease. Um, so human pathogens include bacteria, we have viruses, we have fungi as well. And these are all microscopic entities. When pathogens invade humans or other living hosts, they grow, reproduce, and make their hosts sick. Diseases caused by germs, they're contagious because the microorganisms that cause them can spread from person to person. Okay, so one germ can spread to other bodies as well through the germ theory. Um, First statement on of the germ theory states that that was stated by the Italian physician named Garolamo, who's pictured here in the mid 1500s. So according to him, he proposed that contagious diseases are caused by transferable seed-like entities, which are now called germs. According to this scientist, germs spread through populations through direct or indirect contact between individuals, making people sick. A bit about evidence from puerperal fever. So one of the first physicians to demonstrate that a more microorganism is the cause of a specific human disease. It was a Hungarian obstetrician, Ignaz Semmelweis, in the 1840s. So the disease was puerperal fever. Often it's a fatal infection. The female reproductive organs are involved in it. Puerperal fever is also called childbed fever because it usually affects women who have given childbirth. And according to the scientist MLBs, he observed that deaths from puerperal fever occurred more often when women had been attended by doctors at his hospital than by midwives at homes. Okay, so there are more deaths happening at the hospital compared to home deliveries. So he was really intrigued by this and did not know why was this being caused. He also noticed that doctors often came directly to autopsies, to the beds of women without about to give birth. So from the autopsy room, they went directly to those cesarean sections or given, there were no cesarean sections at that time, but there were mostly like normal deliveries. From this observation, Semmelweis um, inferred that puerperal fever was a contagious disease because it was traveling from one dead person to another, as by some type of matter carried to pregnant patients on the hands of the doctors from autopsied bodies. As a consequence, Semmelweis urged doctors and medical students at his hospital to wash their hands with chlorinated lime water before examining pregnant women. After this change, the hospital's death rate for women who had just given birth fell from 18% to a huge downward leap of 2%. So that was huge. After this change, and this happened when they were washing their hands. This started by then, this was a 90% reduction. So this is the father of the germ theory. Louis Pasteur investigated the causes of disease as puerperal fever. So this is the organism that you see under the microscope. So throughout the later 1800s, more formal investigations were conducted about the relationship between germs and diseases. Some of the most important were undertaken by Louis Pasteur. This picture is here. Pasteur was a French chemist who did careful experiments to show that fermentation, food spoilage, and certain diseases are caused by microorganisms, and he discovered the cause of puerperal fever in 1879. He determined it was an infection caused by the bacterium Streptococcus pyogenes, which is shown under the microscope. So this you can see is like a chain, like that's how it gets its name, Streptococcus. Although Louis Pasteur was not the first person to propose germ theory, his investigations clearly supported it. He has also become a strong proponent of the theory and managed to convince most of the scientific community of his validity. For these reasons, Pasteur is often regarded as the father of germ theory. So in summary for this session, scientific theory is a broad explanation that is widely accepted because it is strongly supported by a great deal of evidence. An example of a scientific theory is the germ theory of disease. According to this theory, contagious diseases are caused by germs and microorganisms. The germ theory of disease was first proposed in the mid-1500s. It was not widely accepted until the late 1800s, which was when it was strongly supported by experimental evidence by Louis Pasteur. These are some of the references that you can have a look at. I will meet you tomorrow, same time, 1 o'clock. If you have any questions, please feel free to email me. Thank you so much for your time, and I'll see you. Take care. Bye.